Her sister. And she thought it was in.
Oh, right, that's great.
Okay. You get them to her hands. Okay.
Probably a real- Yeah, well, this is sure Tony came by,
Just so good.
I haven't done anything. And I think she was, they had, you know,
She's a nice girl. Yeah.
and my daughters. They're eight.
all that feel.
Yeah, the other one.
And then it just.
I don't think she's leaving it. I don't think she's ever gonna, I don't know if she'll ever get.
No, it's not. And I didn't.
You know, I have to tell you, it's kind of fun. That it's for you to get that. So hard is hours. I would have.
An hour.
Yeah. So hard. At the end of the.
They were on.
party.
At least a half hour.
Take on.
I don't know how.
I don't think an hour is quite.
You don't think so?
I don't.
Pretty good. I mean, I'm mostly your way here at 2:38.
He's like, oh, well, how would I cook?
Yeah.
I don't know how that would all work. I don't
How long
know.
will they?
He said,
Yes.
and then she, what I did, she never,
She kept putting it on.
she never went. for
That's fine.
any of that.
All right.
Yeah.
I'm this.
Sure they have other.
Yeah, she was, yeah, good person. Oh, yeah.
And their cousin.
It's listed.
Yeah.
I could just. No. So what color, I haven't seen it, so what?
No, it's all red. It's colored.
Red.
More red.
I know, yeah. Well, the whole thing is, I truly think that.
It doesn't want to go
You
along.
don't want to be wrong.
It
I told you that.
It's not available. This is easy.
It's more comfortable for Jen than trying to go out and date and find somebody.
So.
So I guess I couldn't blame him for that, or I don't know, whatever. It is what it is. Cheers.
All right.
Yay, now you're ready.
Yeah, it's scheduled already, so.
I don't have an agenda.
Oh, Brian's got him. I think he needs one. I can share my iPad, but.
We have paper copies. Thanks, Mom.
What? Must be, well, I got the iPad.
I've got.
You get it?
Okay, we're gonna start right out with Oldest. General update. Good morning.
Good morning.
Morning.
We're going to, update the general update from the hospital and, understanding correctly, I don't go into executive session and talk about the vote plan. Yeah, You want to figure it out? With that discussion?
No.
No. It's general updates. Yeah, so we was. So, the market forces here, our loss in, August. 1.6 million, and if you recall, we've been trending since spring, around 2 million, 1.7, 1.6, with some other non-operating funds, going more details. The actual net loss was about 10.5%. So, I think the board of managers meeting last week, the, when there's more details about it, we're in the improvement. We met with somebody who offline to be. The hospital job is making improvements, they're very strong. For reasons that we talked about, in the past with the public entity. So the service loss personnel changes, contractual adjustments and renegotiating, it takes some time. So we're about 4 months into a turnaround again. And, we're probably where we would have to be at this point. But it is. Okay. Volumes,
Sure. So from a volume perspective for August, we've seen pretty much what we had seen the past couple of months. Inpatient volumes have actually improved. Acute was over early on. It was up 9% for the month and is actually 15% higher than what we were last year. Mental health and skilled nursing facilities are both pretty much entirely full. Mental health for the year actually is running 3% higher than last year. Skilled nursing is around last year. Big issue driving losses right now is the fact that our outpatient volumes are down. If you look at our emergency room, which had been running favorable to budget, they were off for the month of August by 6%. They are still favorable compared to last year by 5%. When you get to outpatient surgeries for the month, they were off 29%. And compared to year-to-date last year, we're down 31%. And then from an ancillary perspective, medical imaging is about 20%. Year-to-date, it's about 12%. Labs down 39%. Year-to-date off 25%. And rehab services are off 15%. Year-to-date are off 16%. In clinics for this particular month, we're going to be off 30%. We had quite a bit of provider time due to some vacations. Year to date, if you look at compared to last year, we're down 5%. So we are again seeing some positives on the inpatient side of the revenue, but some pretty steep drop offs at this point on the outpatient side of the revenue. Spend wise, we came in at just over $7 million, which was about 100,000 higher than what was budgeted. One of the things that we covered with the board of managers was the fact that if you go back to the March time frame, we're at about 870,000 for that month for agency costs. This past month, it continues to trend downward. We're down to 420. So it's has gone on over the past few months. As Dave mentioned, the loss for the month was 1.6 million. We did get 400,000 in for the lab project reimbursement from the state, so our bottom line. So you look year to date, our loss is 16.8 million. After non-operating revenue, it's at about 10.6 million. Still projecting bottom line right now to be around 18 million. It's improved some from where we were a month ago, but we're still sort of trending at that same spot. And part of that, as Dave said, making some of these adjustments, it's taking 30 to 60 days for the actual search.
Any questions about it? What's about that? Kind of keeping Mark's update, kind of an anomaly with Wyoming County. Our inpatient is actually outpatient stance, and most other places are really saying the opposite. Inpatient's down a little bit, and outpatient is picking up. And outpatient is really where the growth is long term. That's where all the insurance companies are pushing volume. So we've got to get that, that business back. In outpatient surgery, same-day surgery, a lot of diagnostic. So we're working on those. Outpatient clinics, continue to work on that again. Just to refresh folks' memory, our health system acquired a lot of practices over the last 100 years. They weren't integrated with standalone. We're bringing those back in. Strategies around building, we have consolidated. Back in January, last year, but also providing a lot of other benefits in terms of collection and credentialing of payers, timeliness, efficiency of dropping bills, all that stuff. Interfaces with our IT systems in operation and the inpatient system at the hospital. We did hire a new orthopedic surgeon, Dr. Sproul. We'll be seeing his likeness kind of plastered all over the county billboards and other ads. He's actually doing an interview on the radio it's next week. The country music station. Yes, so we'll be doing that. Good guy. He's from spent a lot of his career for state of York, Syracuse, fellowship trained, boarded. He does so. They already got it scheduled, so good news in that front. He is a little bit older, just wants to work about another year and a half. He's going to work part time, 2 weeks on, 2 weeks off. Dr. Brewer, some of you may know Dr. Brewer at Arcade. Kind of taking over for Dr. Dean. He's been appointed as a clinical director for Arcade and provide some support for their support in addition to our operation. And one of Dr. Brewer's key challenge is to roles. Probably some getting about 10% of our case business revenue. Same thing in Attica. Some other efforts in that regard. Some success on that. Ross, those group only improve their extra while in January 1st. Typically, what we've been getting fast. So these increases collectively are over 6%. Also, negotiating new agreements. Balance has been, I think, as folks know, opened in January. The county that ramped up. We are full half-time. So Monday, Wednesday, and Friday, 20 days, there's 5 chairs, basically 6. Stand 5. So it's 10 days. Those days, 50% basically. We'll be opening on Tuesday, Thursday, and Saturday in 2 weeks. So we'll have 100% capacity. renal patients. To let's. Also. Aging. And. Then. Start. Help us with. Actively, general surgeon. The position. Also. Technical program update, we did have a little bit more in our volume for August. We're now projecting, I think, 180 births. For the year, it was about 170 for tick. We are having an assessment done by Women and Children's in Buffalo, Shy. They will be doing an assessment of our major surgical program, kind of an operational strategic assessment. It's a wise thing to do. As I said, this was the volume. Program, so we want to make sure. Mitigate those. It's I'm going to go through those details, but we have copies that we can send to you folks, and you can see that. But there are print ads that have gone out in the last month or two with all of our providers, some of our programs. Dr. Marketia and AFCA, the rest of the market also got as one of the stores. And again, they are handing out plastic bags. So we've got our likeness and our logo and our phone numbers on all those in separate files and bags. Good way to advertise. And then we're doing billboards and also podiatry. The company is being that's it. Question for me before we
Dave, I have a question. Are you aware that Genesee Orthopedics out of Rochester Regional Health just opened an office in Warsaw?
Yeah, we did hear some rumblings about that. It's continuing to kind of pick away at the market. That, as I noted, the world keeps getting more than 70% across Wyoming County is exiting right now, and we've got to aggressively contact that. So we're looking for orthopedic surgeons.
Okay. And then a question for Mark. So several months ago, Mark, this committee approved, I think, a $7 million figure to meet the operational expenses of the hospital through the rest of 2022. Is that still a valid number?
Yeah, we're still pretty much trending to that as we said today.
Okay.
And the big number in that 7 million is almost 4 million cash contribution for December, which isn't going to change.
Sure. Okay.
I have a question on billing for, I saw Dr. Ali at the end of May. And I know they went through the insurance and everything, but I just got billed for the deductible at the end of September. Why is billing take months?
Well,
When you're looking at, businesses don't do that. They bill 30 days out, you're getting your bill.
right. So that is one of the reasons why we were trying to get to one consolidated billing for our practices. In the case of Dr. Ali, I think fairly recently, there were some credentialing delays getting set up. And again, in the model that we currently had, we had part of the credentialing being done by one of the billing groups, we had part of the credentialing being done internally with some staff, we had staff turnover in that area. Again, when we, as we're moving forward, we're gonna have one who's building a credentialing for all positions.
Hopefully
for
your,
us
your
to get more time.
turnover is faster and your income's coming back.
Right, on the hospital side, our days are down to 62 days right now, goal is to get them to 50. We've been working through that process, we're at 69, 4 months ago. On the 50 side, we're more around 80 right now, and then with the transition to a new group, there's some very, there's some inefficiency right now. We have both of these groups working within the same computer platform, running off of NetIn, and there's just issues with remittances will come in. They have things code, we're not getting this apart, so it'll just be a much more efficient model once we can get there, which will be key.
Questions? Questions? Two. Starting page 8, number two, this Angela Potter, both these 2 and 3, Angela Potter and Ashley Park. We understand it, but they weren't memorialized into new agreements. I said that shortly. These were both level providers in our arcade clinic, and were adjustments to their compensation and productivity incentives. This is basically to memorialize those and make it permanent. Angela Potter, one agreement. Number 1, effective retro, January 1, base compensation change from 93 to 100. And there's a stipend, this is the productivity amount. So based on how hard this provider works, they can earn up more than work. $29.47 per work hour used is the unit billing. Greater than 2,600 are used per year. Number 3, similar actually arts employment agreement. Then number 1 again, effective retro, January 1, compensation from 42.62 per hour to a base salary. This employee actually base hourly, which is incorrect. So we've got our base salary, and she has a stipend. Same thing again, 29.47 per hour used for different. And the 2 effective. Reduce the compensation from 90 to 80. She's going from to a part-time status 3 days a week. So that's the 0.9 FTE to 0.8. Number 4, this is Brainware, which is the software system that's hospital with security to help us optimize our charges and our chart master. So on its current, we are automatically books within our region to make sure that we benchmark appropriately. X-rays, lab tests, so go on. This was approved prior to this one. So this takes it out a few years. Yep. So this is an extension for 3 years. This is a wise investment. We've had several instances, I may have mentioned, severely under what it was costing us for services. The example I used was TT with the governments for $150 an hour. It costs us well over $1,000 to do those. With this system, those will automatically be updated in real time. So that's the Brainware. That's increased the cost of 91 per term. And the training fee, there's $6,000 plus $50,000 per year. So that's over years. Number 5, no anesthesia, this just raises the do not exceed amount. 6 million, as you both are aware, in addition to HBC nursing RNs, there's also a shortage of anesthesia providers and this is to follow up with the services. This is the laboratory validation project. And then the PIs, we need to 1.2 million and grow it to 172,000. Big project. Number 7, professional services agreement. This is for linen scrubs. Our loss rate, women's and scrubs for clinical personnel is a significant loss to the health system every year. These are where scrubs are taken by employees and providers, not returned. And so our loss rate is significant. This is one of the systems that's going to track those. It's called HealthWare. $35,000 a year. Number 8 is the pediatrician. And the cases afterwards. This is to cover our 2 providers for pediatrician and also Dr. Don House, family practitioner. Number 9, professional service agreement. And this is for the orthopedic division system, $129,000 effective in February. Now with Dr. Stoll and Dr. Tara. Number 10, professional services. This is national healthcare, which is the backing needs and how we define provider and short staff, not to exceed $400,000 a year. Number 11 is an upgrade to our tax system, which stands for Sure 501 computer system. That's basically all the images that they take now with X-rays are no longer hard film, they're all digitized. They go into this tax system. Ours is antiquated and this allows us to upgrade that. Number 12, professional services contract for laundry, mechanical contractors. These are 2 rooftop units. One is a skilled nursing facility, one is hospital. You can see their mechanical piping, pumps, valves, so for infrastructure for $502,000 base bid, $25,000 contingency, $527,000 total. That is 10-12 next week. Project completion. This is a one number 13 contract. Innovative project.
Hey, can I make, for a second, would you look at those numbers again for Randy? 502 and 25 is 547. Where do we throw that extra $300?
I think there's a typo, sure.
Maybe so it would be the 547 even, you think?
527.
Okay, thank you.
Sorry, 13 innovative project. Again, this is scrubs. The amount of money the hospital uses something that really is scrubs. It's disappointing, but it's tens of thousands of dollars a year. The prior item that I mentioned, and this one, will control that, it's $90,000 per year. He's got chips embedded in the scrub, so staff or providers take them or order them in the clinics, so we know exactly what they are. And we can go get them, or if they're lost, we can charge the employee. Let's see, number 14, space plan. These are affordable. We system are monitoring. Basically, we have them in the hospital. Right. $3,000. And let's see, the last one under salary schedules, director of special project, $95,000. Director of clinic operations increased to $100,000 a year. Financial analyst position. Fiscal services. This is a one-time stipend from an employee. Who is currently covering two roles. They support that individual on their jobs. Grade one position, community director of nursing. That's salary 135, the replacement for county auditor who retired last month. It's a replacement in the hospital. Army Regular TV administrative coordinator, $1 per hour. I believe this is the non-staff office stand. That's correct. And this is the replacement for Benny Mark, who retired last year, is working for BN for us right now, but was not going to work for the rest of the life. And abolish one chief nursing officer position. This is county's position. We're abolishing the CNO and replacing it with a director of nursing, which is what the state calls the position anyways, and also increasing salary. And abolishing an outpatient supervisor position. Number 16, and salary schedule P. Follows the family practice physician providers, Dr. Brewer in Arcade, taking the role of clinical director for the clinic and paying him and stipend of $1,000 contract. Expires early next year for the process of renegotiating and contract. And so the salary of 0.8 FTE. In the arcade clinic at $80,000, after she employed program. That's a lot. Any questions or concerns about any of that? Questions on 2 through 15. Motion by Supervisor Lucas. Over discussion, all in favor?
Aye.
Opposed? All right. You guys go to the next session. Yeah, this involves personnel and there's also a legal issue that we applied to.
Make a motion.
There's a change, but I would stop it. We'll just
I knew that Logan showed.
Somebody. All in favor?
Aye.
Opposed? Very good.